This podcast is kindly supported by our friends at Acre Pharmacy, one of the key aesthetic pharmacies leading the way in responsible supply.
Right, guys, as you remember, what feels like a lifetime ago, we discussed machines on our podcast. And if you remember rightly, the girls had mentioned that they were in a position at the time where they've never felt ready to get a machine. They hadn't found a machine that was grabbing them. And they have now come over to the dark side. I have won. They are loving life. And we're going to talk machines take 2.
We now have no more room in our clinic.
Yes.
Chucking stuff out because the machines are taking the room. And everyone's like, oh, who's putting the machine in the corridor because you're wheeling it out of the way? But we went, and in my clinic, we had quite a few demos, actually. We didn't know what to get. And we went for a Neogen spa. And it is completely fully booked us for January and February and March.
Yeah.
I'm not going to lie. It's
Fantastic.
now fastly becoming one of our most popular machines and one of our most popular treatments. And we love doing it.
I told you you'd love it.
Mm-hmm. We do really, really love it.
It's an amazing.
Yeah.
And do you know, I think why I like it? I think I like it because you can control it and tailor it.
Mm-hmm.
So you feel very calm doing it because you can almost baby step it. You can, if you've got a patient who's nervous, got a patient who wants to kind of go into it so that you can reduce the joules, you have that full control over it.
I love the fact that there's not many things that you can't treat.
Oh, absolutely.
Like eyes I find are like a huge thing in aesthetics, that everyone wants to change the eyes, and we know that obviously teardrop filler isn't suitable for everyone, and skin quality is huge, and the fact that you can treat eyelids and right the way up to lash line with this machine, it's like a game changer for us.
We did one we shared it on our story. We measured her eye, we did from the lid upwards, and we did loads of measurements because she wanted to lift her brow. We treated obviously the forehead and laterally as well, and we got a 4mm lift on the arch of her brow.
Amazing.
And completely transformed her upper lid and smoothed out the lower. She was on that cusp of surgical patient or not, and she pulled it right down. She did a great video talking about it because she said it's literally changed her life.
And the other one that I think has been life-changing for a lot of our patients is our acne patients. So patients who come in and they've got the like flared acne at the time, they always were booking in for kind of like chemical peels or microneedling. And we know that we can't do that over active acne. You spread it. So the fact that you can do this on active acne, on active fungal infections, you can treat it. And the rate is insane at how quick it clears up. Like we have one patient, I'm so excited to share her photos because after one treatment, her difference is just incredible. Incredible.
I like the fact that it doesn't compromise that barrier as well though. So, sometimes you'd worry about infections and things like that.
Can you tell it? It makes me
I'm going to leave you guys to have your Neogen date. I'll be back in a minute.
Do you know what it is? I think what it is, and me and you share our love for another machine as well, so let's not go there. But I think the thing is, you look at these machines, you get worried, and it is all about taking the step. And once you take the step, you get annoyed that you didn't take it sooner. Yeah. Because the real reason, like I said, and at the beginning, I think a lot of it is fear. But when you dig down deep enough, you don't need to be afraid. Let your numbers dictate what machine will fit. And once you do that, you kind of get this sense of, oh, do you know what? This will work.
Yeah.
And then you just show yourself it'll work. And then you just want to tell everyone to do it. And then you see them having that fear that you had. Yeah. And you kind of like, don't do it. And I think one thing I like about the Neogen, I will say, and this is probably the same with your, because you have the RF microneedling.
I do indeed.
Is the treatment, the revenue per treatment, you can get quite high revenues. For a lot of people who are, they go, oh, I really don't want to get a machine. All I'm doing really is just, lips and toxin and this.
They just see the outlay. They don't see the revenue.
And then I'll go, okay, so you can make £200-300 doing a set of lips in that time, whereas if you did this treatment you could double that. And then imagine if you do 5 of them a week.
And also we need to remember that some people, when they first start in aesthetics, obviously they wouldn't have maybe the cash flow to do an outlay like this.
And if you don't, we've got a great blog on that.
This is very true.
But also there's like the fear aspect. I think we forget that people are really scared to do dermal filler treatments through risk of complications. And I do think that if you have a machine, like you said, yes, you can make more revenue, but also the fear aspect, a little bit like you guys have just touched on, is less. And I think the risk profile as well, potentially slightly different, but still makes you feel a little bit more sort of a little bit humble in your treatment.
Procedure to do, and you're with your patient. I feel like all the patients that have come over onto Neogen, we are learning so much more about them because they are with us for say 90 minutes, and they sit with their numbing and having a coffee or whatever, and then we're spending so much more time in the treatment room, and it's quite a comfortable procedure that they're chatting to us.
This is, do you know what? I tell people this because I think they've been. When Neogen was launched and really made its way into the headlines, people seeing Alice Hart-Davis and that picture of her peeling stage.
Yeah, that's
and I think a lot of people have been frightened of that. And actually, you know, I said this to you before you got it. I said, Grace, you need to get on this because it is nowhere near what they think. And what I tend to do when I'm consulting is I just do a few on the hand. And they go, is that it?
Yeah.
And I went, and you will be numbed.
Yeah.
Before we see you, we will put some topical anaesthetic on. And actually, I think they feel really relaxed. But with the help of, you know, using the appropriate aftercare as well,
Definitely.
you know, you can expedite that further. You know, we use Selderma, a GF5, as our go-to aftercare because people will say they want to feel tight, they love the fact it feels tight, but they need the skin peeling element to dissipate as quick as possible.
Yeah, that's
but they still want to keep the benefit. They don't want to do it in case it's going to interrupt it. And what we've seen is we've treated all our patients now, and we include it as part of the treatment. They have to have the Selderma GF5 because we know it just makes it so much more comfortable.
Yeah,
and you see a big difference. And I'll tell you what I will say though. I was talking to Selderma about this. The patients who at the beginning who didn't have Selderma as their aftercare, when they came back for the second, I always felt that they respond differently the second time when they've had Selderma, almost like they tolerate it better in a way. Their skin health is better. I do think it just adds an extra synergy to the treatment, so they're just going to get a better result.
Definitely.
And do you know what's nice about the Neogen is
But you can use any aftercare. That's just what I use. I'm just sharing my journey. Just
you still get great results even from the lower jaws as
my
well.
God, yeah.
It's honestly, that's what I love is the people who don't want to do that.
Yeah.
So they don't want to have the extreme downtime. They want to do maybe a couple more procedures, but reduce that kind of peeling stage. They can do that and they still reach the same end
100%.
goal. Okay, they need to have a few more.
People have busy lives now, Grace. They don't want to be out of
wouldn't
action
want
for a
to,
week,
no.
2 weeks. I'd say I do in the majority of mine, I'd say between 1.2, 1.8 in that region. But I have done them at 0.8 and 1 as well, absolutely. And for patients who were like, I'm busy, I haven't got time, I'm happy to, and you have that conversation, you may have to have a few more. Are you okay with that? Yeah, that's fine. I'd rather do that than have the downtime. That's fine. And that's, I think, why I love it, because you can tailor it. You can pull that back. You don't have to use a different modality. It does all that. I'm so glad I have got you onto the Neogen hype.
I am fully in the Neogen hype, knee deep in it.
You do.
So I've got the RF microneedling.
Yeah. How are you getting on with that?
3D.
Oh, but do you know what?
Interested in
I am interested because
3D.
you have been smashing some great before and afters. So how did you find integrating that?
Actually really easy, to be honest. So my clinic is very much skin focused. I still do dermal fillers and toxin treatments. But I found it extremely easy. I had a high percentage of people that were already on their microneedling journey, but I was finding that the downtime was an issue, like you've said, and the results were taking
a little bit longer.
Yeah, a little bit longer. You would still get there, but it would just be a little bit longer. So it'd be people that had finished their acne journey with me from chemical peels or however we've got them to their end goal where they've got scarring. a vast majority of my patients were at that point. So then when I introduced the RF microneedling and talked about scarring and the fact that, you know, you start with your 3 treatments, they're a month apart and you will see massive results, because I describe it as microneedling on steroids.
Yeah.
It's the easiest way to describe it, because I think people find all of the technology quite confusing. And, you know, once you get them in clinic and you go through and you explain it, then yes, they will understand. But in terms of quick, snappy, this is what it's going to do and this is the results, that's how I describe it, and it works. So I've seen incredible results with texture changes, scarring, but even sometimes with sort of surgical scars, I've seen a massive difference. Stretch marks, incredible results. I've got one lady who's nearly at the end of her journey, and like you said with your treatment, you're really excited to share the before and after. I'm really excited to share the
Imagine if you could, especially with stretch marks, if you could prime them as well with like...
That's what I've done with this lady.
I knew you would.
Yeah.
You knew you would. So good. What with polynucleotides?
Yeah.
Love that. So if anyone's watching as well, the RF microneedling, you have the Dermaforce. So it's similar kind of machine to like the InMode, Morpheus, that kind of technology, just in case anyone's wondering what the machine is.
No, definitely. But the skin tightening aspect is insane. And especially for... well, it can be for men as well. Everybody has stretch marks in one place or another, I'm sure. But for postpartum tummies, on the right candidate, obviously after full consultation, the results are incredible. And I love it when someone comes in and they've got like a little jig about themselves. Because you can feel crap.
Yeah,
like, I mean, I haven't had a baby.
You've seen it.
Yeah, you can feel it coming off of them. And like, this is just amazing. Like, I'm so happy that I did it.
How do patients tolerate it?
Quite well, to be honest. They can be a little bit uncomfy. So the first pass, I'll just tend to keep it not superficial, but not as deep, and the RF fairly low, just to see how their downtime is and how they'll tolerate it. And I will say, yes, you will get a result, but it won't be as like noticeable
you need
as the second part. Yeah, because you have no idea how somebody's going to react, even in front of your eyes, because... So when I did my training, they told us not to use numbing cream just because you need to see the skin reaction, because it can obviously dampen what's going on underneath. But sometimes if people are uncomfortable, I will opt for some Amla cream, definitely.
But you know what? I suppose that...
you can ice.
I suppose using that Target Cool...
would be amazing.
Sorry, we always forget people haven't been privy to the 5 million conversations that we have outside of this. But, you know, we were talking about Target Cool and the machine that I got to play with last week, and I'm waiting for its delivery. And that essentially is using like that cryotherapy to cool the skin for pain relief, but you can also use it with the administration of exosomes and things like that. So imagine for a treatment like that, which people find quite uncomfortable, where you don't want to use...
I think the results could be heightened as well.
Absolutely.
Yeah, because you don't want to, you know, make
and the healing would probably be expedited as well.
Definitely. Yeah. I mean, of our other machine that we do love, that massively helps with
But can you
healing.
imagine, it'd be quite easy as well, because of the way you administer that Dermaforce, even using the Target Cool at the same
you've got
time.
a spare hand.
I'm really excited to see your Target Cool. Like, that is next.
Do you know what? It's actually, in my head, when I went to see it, obviously you see it, but it felt a lot better than I thought it would. Do you know what I mean? I kind of in my head thought, is it going to be like really flimsy?
I've just seen a video today come up of it being used.
It's really sturdy, and it's quite solid. And, you know, Paul, who's speaking at our event, he's released some videos of how he actually treats and injects lip filler with using it at the same time. So he uses it at the same time. I mean, if you're lucky enough to have other people in, you'd probably get them to support and do it. But he does it, and so that would be interesting to see. But
did you try it on yourself?
Yeah, I tried it on my hand. But even when I tried it at the so you obviously control the temperature. So I had it, I think, at 0.2, so not minus, and it was at the rate that you would have it if you were using the, say, for example, exosomes. So you would essentially microneedle the skin with the exosomes, and then you would use the Target Cool at the end as well. So you would use them at the same time. You can use it on the hair, so great results. And there's a little, like a little container. You can tailor that, so it will go on forever about it. But you attach it, and then you can spray it on. So for me, whenever I buy a machine, I don't want a machine that can only be used by one person. It's not an investment. It's not a return on investment for me. But when I seen that Target Cool, I was thinking, God, Leanne when she's doing SPMU, and she's got people, because she doesn't like using numbing cream because she always says it changes the tissue and she can't interpret it very well. And I always think, imagine that you'd be able to vasodilate the region, you're going to reduce freezing, expedite healing. I was thinking this could work for her. And then Courtney, when she's treating post-surgical, post-pregnancy in the scarring, I was thinking, I want this, because I can see it, how it can be universally treated with the machines.
Yeah.
I don't know if I would use it with the Neogen, simply because the Neogen is thermal. There's a lot of there's a thermal element to it. So the temperatures are...
You want your heat.
You
to
want
a
your
certain
heat.
extent.
But there's a clinical trial
Polly's-
for me to see. I'll do it. We're currently
definitely.
wrapping up. We're writing a clinical paper at the minute where we've primed 5 patients with polynucleotides. So it's a purely based on the periocular. We've primed 5 with the polynucleotides, and then we've treated them with Neogen, and then we've done 5 where we've just treated them with Neogen. We're going to compare. We've grouped them. We're nearly finished. We've got one last treatment for everybody, and then it'll get back to writing that bad boy up. But that in itself, and we're doing another one for exosomes as well that we're going to be starting in the next couple of weeks with the target curl. So it may well be worth even doing something with the target or Neogen and assessing, does it actually impact the result by doing that? I don't know. My thought process would be that it might, but I don't know. So I might try that and see. But without further ado, we need to talk about mine and Megan's favourite little toy that Grace is
I'm nearly there.
She's nearly there.
I'm nearly there. I lost my wrap.
You like, yeah. She's coming back. She's coming back. We have to. You know what? I need to tell people this. And I know, full disclosure. Obviously, I have my relationship with Dermfocus, but people need Dermalux. But people need to understand that the relationship I have with Dermalux is a complete organic one. My thought process with the Dermalux is this: we live in a world where people are busy. We live in a world where people want regenerative treatments that have no downtime and reduced risk factors. I do not understand how people... I actually think, I'm going to say it here, make a note, knocking on the table, this is it. I can see in 3 years, not even 3 years, 2 years, that it will become unheard of for an aesthetic practice not to have one. I'm telling you, it's coming, because it is a no-brainer to me. You can expedite healing. It supports every other treatment that you're doing. It reduces infections. It improves healing. It treats acne naturally on a cellular level.
And it's its own treatment.
Its own treatment. So not only is it going to literally aid everything that you're doing, and then it's also gonna
It's not technically like using your time. Like when I was
100%.
speaking to Dermalux, because I really, really, really need to get this Dermalux into my clinic. When I was speaking to them about it, they said, like, my therapist can put them after I finish my treatment, can use my Dermalux. I don't have to even do that, which I think is just amazing.
Well, it's like, and the thing is though, as well,
time as well.
It's unbelievable. But like you say, that you do the same. You have it.
everyone
Yeah,
underneath it.
absolutely.
So I had a lady come in with a cold sore, and surprise, or no surprise, popped her under the Dermalux, and it was a free treatment. And I think it's definitely made her into a repeat customer. You know, she feels good. It's made her face feel a bit nicer, because we all know how embarrassing, or might know how embarrassing cold sores are when you have them. So I think, you know, it just works with every single treatment.
But you know what? They've got, obviously, I think the key is we see people using these masks that they can buy off Amazon or eBay or wherever else. I won't mention just one, all of them.
Not to be
I'm not to be discriminatory. Anyone else?
We love you,
Any
Amazon.
other?
Yeah, if you want to buy it from Amazon, go for it.
Go
We
for
love
it.
this one.
Oh my God, do whatever you want. Sorry, gone on rogue. But
World
peace.
peace.
World peace. I'm so sorry. But you see these people, world peace. Oh my God, that's hilarious.
peace.
That is so great. But it's a true story, isn't it? You're always like questioning yourself. But I'm totally going off on a rampage. But you see people all the time using these imitations, and I'm going to use the word imitations because they've got the technology somewhat right, but they don't have the power or the backing or the science backing. And I think it irritates me. Go, oh, that doesn't work for me. I have it on my sunbed. Oh, I've got one of these. I bought one from the shop.
It's when they start the sentence with, well, when I put it on the orange light.
Yeah, it's like, what orange light?
It's very similar, like buying your treat your mask off eBay is similar to like buying Amazon's collagen tablets versus
Yeah.
Skin Aid.
100%.
Like, there's no science behind it. You're completely technically wasting money most of the time.
Yeah, but they can get it. It's kind of going on. But I think, you know, we need to give them the credit where it's due. It's medically certified. So it's a medically certified treatment for acne, wound healing, psoriasis. These are massive things. If you've, my dad had psoriasis, and it literally was all over his body, and he tried everything. And obviously he passed when I was 18, so we're talking a long time ago when this wasn't available then, but he tried everything, literally everything. And I think when I see women who are really struggling with it, and yes, you're not going to get rid of it, it is management of a condition. That's fine. But to these people who are struggling with that, managing their condition is great.
Yeah,
That's
any
life-changing.
improvement. Yeah.
And we have the ability to give it to them. Like, we're doing, we've set a goal this year to do 4 papers with Dermalux, and we've said that we're going to do one about acne, we're going to do one about mood, because we know categorically the feel-good factor, the SAD element of it is immense.
People come back in and just say, that made me feel really
so much
good.
better. I feel calmer. I slept better.
Yeah.
I feel less anxious. That's massive, you know, and the impact that will have. And some other bits and bobs, because it really, I mean, don't get me wrong, it's very much backed by evidence, very much, otherwise it wouldn't have its medical certification. But it's still to this day, and I've had my TriWev MD for 3 years, I think, and we've just got the MD second generation through last week.
Say it again.
Second generation. I am one of the first to get my new
You
toy.
have to let us say that, guys. You've got to give
VIP. No, I'm joking. I'm not joking. But genuinely, like, this machine is just amazing. And the things, I said it to you in the taxi, didn't I? There's nothing I didn't like about the TriWave MD, but getting the second generation one, it's coming, I'm like, oh, I love you even more. I didn't even know that was possible.
But what I love about it as well is it's so versatile. It's not just, you know, you've got the TriWave, I've got a compact light. But you can get a Dermalux Flex. Like, your patients could get a Dermalux Flex at home.
That compact light though is a really good piece of kit. I like the diversity. And if you've got
space.
if you've got loads of clinic rooms, and you could literally just plug that in.
You could literally, you can put it in your car and take it with you, and it's still more powerful than a device that you're going to be utilizing at home. So therefore you are above, it sets you above, doesn't it? So people are going to come into clinic to have that treatment.
They have Dermalux kind of have it for all practitioners, don't they? They have it for practitioners that are starting out and maybe don't have the budget or the space, and then they've got it,
but they can still enhance results.
Yeah, and then obviously can work with it, and then you're technically using your first machine to buy off your second machine, and you're working your way up.
But do you know what? I say this, I said it on the first podcast and I'll say it again, it will and will always be my workhorse, and I love it to pieces. And no one is ever taking it off me.
Just reminds me of that image.
You got up the horse head. You just put like a horse head over me. Like, do you remember when she did it? I was like, because I said workhorse, and then I just had a horse head. It's like, thanks for that, Megan. But it's true though. Now you get why I get so giddy about it.
I love it.
Because it's great. But I will say a thing as well. We live in our world is very, I'm not going to say shallow, but we are the Oscars of medicine. Let's be fair. Let's just call it a spade. It is.
We are.
The industry is that way. It's not us. It's the industry. Yeah. So to have a piece of kit that is so Instagrammable is always a perk.
Definitely. I turn my lights off and then I take my videos. Like, look at my room.
Content, totally transform content. But do you know what? One of the things that we wanted to do from the beginning, we're sharing you our stories here, and we've got other devices that we can talk about. But the key is, what we're trying to say is, we're not saying we are saying these are great devices. Please be clear, we are saying that. But we're not saying that the others aren't, you know, though what we're just trying to say is be brave enough to kind of get involved.
Now I can't wait to get more machines. I've actually got Kate's machine bug. Like,
I've got nowhere to put any.
Well, I get a new one soon. I'm not telling you what it is. That will take me to number 9.
Yeah. I'm on my list.
I need
I find myself scrolling, looking at machines now. I'm like, oh my God, I'm so Kate.
But you know what though? Because you realise that there's an element of how did I treat my patients before? Don't tell me you haven't thought about that. Where you go, how did I treat this indication before?
Yeah.
Because like really nothing.
You're so limited.
You're so
No,
limited.
I've got so many options.
That's it. It's
Someone
choice,
comes in,
isn't it?
literally a lady came in
We've got
yesterday.
this and we've got this.
Yeah, and she was like, my under eye, and she was like, I want filler, not a filler candidate, like straight away. But then I was like, oh, actually, we've got Polys and I've got Jalapro and I've got the Neogen. And then they've got so many options depending on budget, downtime. Like,
Yeah.
I'm like, here's all my options.
It is
Take
great.
a whole week reading them.
No, but do you know what? Megan, you did a post about this the other day. We say this all the time. You know, you did a post about, you said about consultation, people coming in.
Oh, yeah.
I love that you're like, what's coming out of your
No, it wasn't anything bad. You do a lot of posts that are hilarious, but this one was extra special. And you talked about the fact that people should come in, be provided with choice, and then go away, reflect on it for as long as you want, and then come back and book in. This whole thing of, we've got to change the industry where people come in and go, I'm having this because a celebrity told me to do it, or because I've seen this. And I think it's starting to change, but it changes by us changing it in our practice. And I think this is it, coming in, here's all your options, this is all your choice.
Yeah.
And I do think that's the limit of the newly qualified in a way, no diss. We learn indications, you know, we learn how to do a set of lips, we learn how to do 3 areas. So we kind of just always navigate towards doing them.
Yeah.
As we grow as practitioners and we get more of a global approach to treating our patients, a more holistic one, we start to play around with new toys. Like, look at our good friend Dev. I mean, if we thought we had any machines, like, but this is the point. Like, he has that, and people would, you know, them at one point in my career might have gone, is that necessary to have that many? And now I'm like, yes,
it is.
It is, because they all do different things. And when you realise what they do, especially when you're like Dr. Dev Patel and you want to tailor treatments and you understand the skin to the very cell that you know, to its individual cell, you've got to have the tools to fine tune it.
Yeah.
So as you grow, you realise these things have a place.
Yeah.
But I think as well, we need to remember that devices aren't only big devices.
100%.
It
Look at
could
the
be
Target
a small one, like your skin scanner, like you wrote
I love
about.
my skin scanner.
Yours is the Observe, isn't it?
Yeah, I've got the Observe.
Yeah.
It's so good. I love that you can like scroll through and like you can literally compare their images and like
Did
scroll.
it have like a database on it?
Yeah,
That's so
yeah,
handy.
and you can like put your skin database on it, and like, so say if you do a course of polys on somebody, and when they come back, you can literally merge the images with a scroller, so you can literally scroll from what they used to look like to what they look like now.
And do you know
It's
what? I'm so sorry to interrupt you, but you need to do that now, because we live in a world of smoke and mirrors on Instagram. You can't trust before and afters now, because people do edit them.
Yeah.
And therefore patients want a little bit more proof. So that is
Definitely.
No,
it backs up everything that you're doing.
It's becoming, so we've just relaunched all our appointment times so that every patient that comes through the door will go on the Observe. If they don't want to sit down and have the breakdown, the analysis, that's fine. But I just think
your
it's part of our
record.
consultation now.
Yeah, but also, without sounding like Kate with a litigation head as usual, but you have a patient who comes in to see you, has a treatment. We had a patient who came to see us and had a course of treatments. And I can tell you without being dramatic in any way that it was Photoshop change. That was the level of the change. In fact, everyone in the clinic was like, wow, when she come back in. But when we sat down, she was like, I can't see any change.
Yeah.
And I was like, sorry? And then when we went, I said, look, we'll go and take these pictures again. And I said, and we'll go, and we took them. And when we come back in, we put the SD card into the screen of the computer. We got her other ones up. And she was like, yeah, but has that filtered it? I was like, you've just watched me take them. And I think we need to appreciate that some people, through whatever barriers that they've got, whether they're problems they've got going on at the moment, self-esteem problems, can't see it.
I think when they see themselves every day, they forget what they used to look
They
like.
forget what do we call it? Perception drift.
You have it with fillers. You have some lip filler, and then
But you
they
can't
message like,
argue
"Oh, my
with the
filler's
fact
gone."
of your skin.
This is what I mean. So that
Yeah.
you have that. Say, for example, I mean, this didn't happen to me, and you know, hopefully it never will, touch wood. But if you did get a patient who then came back and was like, maybe went all Karen on a keyboard warrior. No offense to any Karens.
World peace.
World peace. World peace. And went and complained or decided, we all see it happen, where people will just go ranting on a social media post. How great would it be that you go, well, I'm quite happy to attach your medically scanned analysis images
This
to
is why
show
this is
proof.
my next
It's great
purchase.
as well because
Skin scanner.
Yeah, what are you going to
can
get the
see
same one as me?
3D.
Visage.
Definitely.
on the Observe, like you can see the patient's dimensions, so you can have a look. Say if you were doing cheek filler, we know that we're all slightly asymmetric. It literally shows
Speak for
you.
yourself.
No, Kate.
No, I'm totally asymmetric.
It's like you can see where it literally shows you, and it like splits all their thirds down, and it shows you like if one side is slightly different to the
Yeah.
other, and it literally you''ve got the hard facts. So you know, if a patient, we know that patients, we all have asymmetries, but they sometimes don't notice them until you've then enhanced them, not their asymmetry, but you enhance their features, and then they notice that slight asymmetry. You've got that for their records, and like even looking at between like epidermal and dermal pigmentation on the Observer, you can see where the pigmentation is lying.
Fine lines, wrinkles,
yeah,
everything.
change your treatment plan. It's
so
honestly
good.
a game changer.
I think the only difference between those two machines is I like my 3D Visage. I've had it for
Oh, you've had it for a while.
a while.
I think I know what you're going to say.
Ruth, who you can't see. Ruth, how long have we had our 3D Visage? 4 years? Yeah. About 4 years. And I love it, and we use it. And it aids in treatments, consultations, skincare sales. But I do find that the machine space is quite a lot. So for those who have a smaller clinic, perhaps the Observe may be better because that is
They're bringing out,
smaller.
side note,
Yep.
they're bringing out a new one that
Yep.
is, I think, similar to
The
the
Observe.
Observe size.
You can get a what's really cool is we've actually just ordered one. Is you can get the Observe stand, so
Yeah.
it changed to height and it's wheelable.
good.
So we've put it in our
That's
reception.
amazing.
So our one of our clinic managers is trained not in interpreting it, but in scanning people.
Yeah.
So literally they can come in, check in, and she can literally skin scan them, and then the results come straight to us. So when they then come in for their consultation, we've got their skin scan results ready. So it is
Amazing.
really
You know what? That's why. But this is what I know. Like we're looking at this. At one point, we'd go, "This is extra." It's not extra. The industry's evolved. It's becoming standard.
Yeah.
It's becoming and it's hard. And this is, I suppose, why we started this in the first place. Because if you are literally just training now, and you're faced with the reality of these things are kind of standard. You know, let's just talk about how you would access that. I mean, I know we've got a couple of our mentorship students who can't access them, and they've gone, what do I do? And we've created, because they're local to us, we've created and said, look, you can send them to us. They can pop in at any point, and we've created some kind of an agreement where we will scan them for them. So I do think if you're sitting there as a new practitioner hearing all this thinking, well, that's all well and good. I'd love a skin scanner and I'd love a Neogen. I'd love that. How do I do it? Talk in your nurse network regional groups and talk about it, because
Does anyone have?
blah, blah. I know a couple of practitioners who actually have she was struggling because she only works 2 days a week. The rest of it is with in the NHS. And she really wanted to buy, it was a Morpheus. And her colleague, who had a clinic as well, 15 miles down the motorway, wanted one as well, but she was in a similar situation. They bought one together.
Yeah.
Yeah.
And they have an agreement that they had a solicitor draft up that says we both look after it, we're both responsible for warranty and repairs, but we're both going to have it.
Share the time with it.
3
And I think the same if you're considering, buying a machine, look around in your local area, go and see how it's being used and how people have launched it. Go and pick someone's brain, spend a day with them. Maybe they might want a little bit of money for their time, or maybe they might not, but I would be more than happy for someone
100%.
to
We've
come
said
and
this,
work
haven't
with
we?
me.
We've always said if anyone's listening to this and thinks, I want to see what the Dermaforce is and they're in your area, reach out.
Yeah.
And
Or
the same
Neogen
to
or
us,
the
absolutely.
Observe,
Yeah.
Because I think sometimes it's all well and good when you, I know we're probably getting in trouble for, I'll get in trouble for saying it again. Stop talking, Kate. But when you are meeting with a company, you expect to be sold to.
Yeah.
Of course you do. You know they're going to tell you that this is the best thing in the world because it's their job to. So we naturally are a little bit more, is it though?
Yeah.
Whereas I turn around and I say to people can ask me any question and they will authentically get my answer.
Yeah.
I will not lie. There is no commercial value for me to lie in that sense. And if people want to come in my clinic and see how much we use our machines, they can come in at any point. I think the difficulty for me is we've got quite a lot of staff at the clinic, and you probably feel like this, guys, and we do a lot of services at the clinic. And sometimes from a social media standpoint, it's the rotation. Do you know what I mean? And it's like, sometimes I think, God, do people think we've got that skin? No, we've got that skin scanner.
Yeah, no.
You know, do they know
hard.
we're doing this? Because you can't give everything the airtime it deserves. That's, I suppose, the benefit of stories and the recommendations.
We've had to rejig our
reviews.
clinic because if I'm honest, and again, I'm happy to talk about like how maybe I went wrong with first launching my skin scanner. So I got my skin scanner. I've had it for.
Do you know
I
what?
don't
That would
know.
be so
Yeah.
interesting.
Maybe that'll do my
That
next
is
blog or
that's a really
something.
good blog, that.
But how I launched it wrongly because I got it and then didn't allocate time for it to be used. So we carried on using our usual treatment.
You didn't
time.
integrate.
Yeah.
Yeah.
And then, so it sat there and then people were going, and we haven't had one person say, no, I don't want to go on the skin scanner.
Yeah.
When they find out, everyone's like, oh my
so
God,
excited to
I want to
see.
see.
Yeah.
But, and every person, if I'm totally honest, that goes on the skin scanner usually leaves with a product or a course of something after seeing their results.
Yeah.
But yeah, we didn't give the time. So that skin scanner became a really expensive ornament in my clinic for months. And then my observed rep, Becca, is lovely. And she came out and she said, why is that in a back room not being used? Like, because I launched it wrong. Now I've nailed it.
Yeah.
But I did it wrong.
But do you know what? I'm working on one of the handouts, and it was, in fact, full disclosure, I actually started it 3 months ago and I forgot. But you've just reminded me, it's going back on my to-do list. But I actually started how do you know what machine will suit you? And it's like a graph, yes, no. It's actually really cool. It's just the layout was stressing me out, so I'm going to attempt it again. But yes, we do all
like a
do
snake
this.
and
We
ladders.
actually all do our own resources. We have no one magically doing them for, and we do them around our crazy
You're
lives and days and children and husband. But that is a good one, because I think it's great to, you want to, if you're thinking about something, maybe something that they can use to kind of just go, right, okay, let me just see if I think, so just a
And
quick
maybe even a
analysis.
bit that says you're not ready yet.
Absolutely.
That's fine.
100%. And I think this is the key, isn't it? Because you're going to have a point when you are ready, but you're just making excuses or you're scared.
Yeah.
And that's fine.
Yeah.
But I always say, think of things as, I said this yesterday to the student, I said, all you need to run a successful business realistically is about 25 clients. You think you're seeing 25 clients, you've got 25 clients in your book, that's all you've got. But you're seeing them consistently for their toxin every 3-4 months of the year. And you look after them and you treat them like a VIP and you send them a follow-up message and you really give them the time they deserve when they come in for a consultation, and you look after them. They will have other treatments. So you think of how much the average person is charging and then look at what the revenue for that is. You could build a career off 25 patients if you've, I hate to sound like a horrible one, but if you've worked them right, if you've treated them right, if you've made them feel as important as they are.
Yeah.
You know, I think sometimes we get so obsessed with, I need another one, I need more. We
on what you
forget
just
to
need to
look after the ones we've got. And these machines allow you to do that. We had a woman who come in last week. She was really fed up. She's got 2 young children. She walked in, she had a treatment, burst into tears and just went, I don't want to go home yet. I've got the kids being looked after for another hour. And it's actually Leanne who was looking after her in the clinic, and Leanne would come out and went, I hope you don't mind, but I've just made that lady, I've given that lady someone brought loads of cakes in. I've given that lady loads of cakes, loads of coffee, and she's just having like a Dermalux. Is that all right? I was like, of course that's all right. And she come out and she was like, that was like really nice, thank you. And it's like, why not? She's knackered. The woman needs to sleep. She's so tired. And you've just been able to make her feel extra
human
happy.
aspect. Yeah.
She only came in for a consultation, but in that consultation, she was like, can I stay a bit longer, please? Like, yes, you can.
Yeah.
Just maybe don't sleep here, but you're welcome to.
I think sometimes we're so focused on like the numbers game that we forget that these people are human and they're just like us. And
Absolutely.
people want to come in and see you.
Absolutely. And that is the value of these machines. When people ask me, I have had so many calls. I had one last week. A woman said to me, how much revenue does that Dermalux make you? And I go, do you know what? That is not the criteria I use to value it, because that is a consumable free treatment that allows me to give my patients
The
a
best
great
result.
experience in every avenue.
They leave feeling, rather than battered and bruised from
Yeah.
a needle, they leave feeling like they've just had a 10-minute or 20-minute holiday.
Yeah.
Like,
Yeah.
yes, please.
Sun damage.
Yeah, absolutely. You know, so yeah, get on board with it, play around with it.
And contact
Go-
us.
Yeah,
speak to us.
Message us.
Yeah.
And we're always at ACE, and we're always at CCR, and we're always at conferences. At least one or two of us out of the three will always be there. If you see us and you're on your own and you want to go and say hi, you know, if you want to go and have a look at a machine, but you're nervous about asking questions, we'll ask them for you. We might even know the answers, to be
might
fair.
have 'em. Kate might even have the machine.
Grace
me.
might,
Give me 6 months.
because she's sat at home reading the brochures
My
for
credit
everyone.
card's like, you take it away from it. No, legs.
We do not need that machine.
Don't. But you know what? Just get on board with it. Have fun with it. Have faith in your business. Look at your numbers
And yourself.
and
And
yourself.
enjoy shopping
it.
around.
And
It's like
enjoy having treatments with it.
Harrods when you can go machine shopping.
I know, it's so good. I'm glad that you two have come over to the dark side. Kate.
World
won.
peace.
World peace. World peace.